This is part 2, Modern Dental Assisting, chapter 48, General Dentistry. In this lecture, we're going to finish up this chapter. So previously in this chapter, we talk about cavity classification, 1 through 5. We're going to move forward and talk about immediate restorations. So this is a restoration placed for a short term, a temporary restoration. Reasons we would place a immediate restoration include waiting to determine the health of a tooth and waiting to receive permanent restoration, as in a crown or inlay or onlay, and then also for financial reasons. Immediate restorations are not to be long-term. Typically, the material is not able to withstand the forces that occur in the oral cavity. Usually say between 2 weeks and 2 months for intermediate restorations. This chapter speaks about veneers. This is a thin layer of tooth-colored material that's applied to the facial surface of a prep tooth, generally used for aesthetics. A direct technique uses composite resins, like our filling material, to create a veneer in the chair. Indirect technique is where we could use a porcelain type and then cement this to the tooth. We talk about tooth whitening and tooth whitening options. This is a non-invasive method of lightening dark or discolored teeth. Phytobleaching uses chemicals to penetrate the enamel and whiten the teeth. Indications for whitening may include extrinsic stains from foods, cigarette smoking, coffee, or tea. With aging, our teeth can become dark and dull. And then intrinsic stains like tetracycline stains and mild fluorosis. There are lots of options for whitening. Once you get into an office and speak with your doctor and what they like, you may also have reps come in and talk about different options for whitening for your patients. A lot of offices offer in-whitening treatment. So this is when we're using an agent with a higher concentration than what a patient can buy over the counter, and typically they'll see the results within 1 hour. There are some at-home treatments available over the counter or in office, and with these, we see a slower result, but they are of lower concentration, and our patients can use them a little bit more often. With our over-the-counter options, these are available easily. You don't get as great results, but again, with the lower concentration, our patients can use these as often as they'd like. With the whitening options, though, we want to be sure that we are informing our patients of sensitivity that can occur, and just preparing them for that. Our role in whitening is going to be assisting in recording the medical dental history. We want to select a shade with the patient before and then after. A lot of times we like to take intraoral photos before and after, just so we can see the difference. We could take and pour our preliminary impression for a custom tray. This would be used for at-home whitening. We would fabricate and trim that tray. We could provide preoperative instructions on use of the material depending on the type of material and the manufacturer's instructions, and then assist in weekly or bi-weekly clinical visits. Instructions for whitening could include brush and floss before tray placement. If they're using a gel, we're going to place that in the tray in equal limited amounts. Less material is going to be better than more, remembering sensitivity. Seat the tray. We're not going to want our patients to eat or drink when wearing the tray. They're going to wear for the recommended time and discontinue if they're seeing any of those adverse effects. Adverse effects could include thermal hypersensitivity, so sensitivity to heat and cold. We could recommend a sensitive toothpaste or something over the counter. And then also, With any of our whitening materials, they can be sensitivity to the tissues in the oral cavity, so we wanna be careful not to get them on the tissues. If this happens, we can talk to the patients about using over-the-counter, vitamin D helps with this, but this could happen when our patient has a tray that's not fitting.